How to give a buttock injection syringe IM injection technique for students. Intramuscular IM injections are an essential nursing and medical skill used to deliver medications into muscle tissue for effective absorption. For healthcare students, learning this procedure requires a strong understanding of anatomy, patient safety, infection prevention, and professional communication. Every IM injection should be performed according to institutional policies and under appropriate supervision during training. The first step in administering an IM injection is careful preparation. Before handling any medication, the healthcare professional reviews the physician's order and confirms the patient's identity using approved identification methods. The medication name, dosage, expiration date, route of administration, and any documented allergies are verified. These important safety checks help prevent medication errors and ensure the patient receives the correct treatment. Hand hygiene is one of the most important parts of infection prevention. Hands are cleaned thoroughly before preparing equipment. The healthcare professional then gathers all necessary supplies, including the prescribed medication, sterile syringe, appropriate needle, alcohol swabs, gloves, gauze, and an approved sharps disposal container. A clean workspace and aseptic technique help reduce the risk of infection. Patient communication is another key part of professional nursing care. Before beginning the procedure, the healthcare professional explains the purpose of the injection, answers any questions, and helps the patient feel comfortable. Many patients experience anxiety before injections, so calm reassurance and respectful communication can greatly improve the overall experience. The patient is positioned comfortably while maintaining privacy and dignity. Healthcare professionals assess the patient carefully and identify the appropriate injection site using accepted anatomical landmarks and current clinical guidelines. Site selection depends on the medication prescribed, the patient's body type, age, muscle development, and healthcare facility protocols. Students learn these assessment skills through classroom instruction, simulation laboratories, and supervised clinical practice. After identifying the injection site, the skin is cleaned with an approved antiseptic and allowed to dry completely. Throughout the procedure, sterile technique is maintained to minimize the risk of contamination. The medication is administered according to established clinical protocols while the patient's comfort and response are observed continuously. Following medication administration, the needle and syringe are immediately disposed of in an approved sharps container without recapping. Proper sharps disposal protects healthcare workers, patients, and others from accidental needle stick injuries. Used materials are discarded according to infection control guidelines. Documentation is an essential.